Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Well, hello, everyone, and welcome back to the TechLink Health Podcast. I'm Justine Reese, hosting today, and today's episode focuses on the role access to capital plays in developing innovative solutions within healthcare to create a better future for all. This episode's guest is Joseph Mokanu, a health tech investor currently serving as a managing director of Verge Health Tech Fund and Verge Capital Management, as well as a non-executive director and advisory board member to a variety of startups. In his work, he invests in technology-led solutions that enable prevention, health system efficiency, or definitive cures with a particular focus on Asian markets. Joseph has a PhD in medical biophysics from the University of Toronto, an MBA focused on health sector entrepreneurship from the Ivy School of Business at Western University, and a molecular genetics and molecular biology focused degree from the University of Toronto, University of Trinity College. Wow. Okay, it goes without saying that Joseph has a depth of expertise, and we look forward to getting his perspectives today. So without further delay, we are excited to welcome Joseph to the podcast. Thanks for coming, Joseph. So glad to see you.
Thanks so much for having me, Justine.
You bet. So listen, to start off, I gave a list of very impressive credits, but can you take a moment to introduce yourself and give us a little more detail about your journey into health tech investing?
Yeah, so you could probably tell that I spent a little bit too much time in school trying to figure out what I wanted to do with myself. We can take an even a step further back from this. I started computer programming from a pretty young age, mostly because I wanted to be able to play video games. And my conservative Eastern European parents said, if you want to play video games, you have to make them yourself.
Wow. Okay. Can I try that with my kids? That's a good plan.
Yeah, well, I think it's going to be a lot easier these days with all like tools and stuff. Back then, it was DOS computers that would take
Right.
minutes to load anything, and you had two colors to choose from, green or black, and it was a different time. But when I realized that maybe programming video games for a living isn't really going to have too much of an impact on the world, and that we get sick and we die from things that might be preventable, I got really interested in science and biology. So that's what led me to study genetics at the University of Toronto. I wanted to actually be a scientist, and I wanted to see if I could develop cures to some serious diseases and be able to spin out companies from it. I actually found my way into business accidentally. I wanted to make a few bucks on the side during grad school and met a medical doctor who needs some help with computer programming, which I happen to be good at. And he had a pretty strong interest in the brain. And that led to the formation of a medical device company focused on brain imaging using EEGs. And that was my first exposure to meeting investors, venture capital, trying to put together business plans and trying to see whether we can take an idea, an invention, and have it actually get out there in the world. We didn't really know too much about business. We didn't really know too much about raising money. We didn't even know to go to the United States to try to raise capital during the post-dot-com bubble crash, where it was a little bit difficult to do this in Canada. But it was a really vital learning point. And I thought, I'd really love to get more involved into business, and then maybe I can even be an investor one day. So I left the startup to do an MBA to study business. And I knew so little about business that I didn't realize that you don't study business, you practice business. So trying to get the top marks in business school is probably the worst thing you can possibly do. You're there to network, you're there to understand what your future business community is going to be like, to practice, to find out where you fit in the grander scheme of things. So luckily, I did manage to get a job in investment after my MBA. But again, timing's everything. And I happened to do my MBA during the great financial crisis. So entrepreneurship and dot-com crash, MBA during great financial crisis. And so I couldn't really find any sort of job in investment in North America. And I ended up overseas in China, of all places, working for a quote unquote friendly activist hedge fund. And that gave me my first taste of the investment world. And it was really exciting. And then I noticed that they were using management consulting techniques to try to add value to their portfolio companies. And I thought, well, hey, that's a really good skill to have. I should probably do this in English, and I should probably, it'd be great if I could do this in nothing but healthcare. So I moved back to Toronto, applied down the list, and went to the first management consultancy that let me do nothing but healthcare and said yes. And that was a firm named Oliver Wyman. Started in their Toronto office, thought I'd do it for 1 or 2 years, and ended up doing it for almost 8 years. And halfway through my tenure, they asked me if I wanted to move to Singapore to help start their healthcare practice. And that was a really exciting opportunity to go to a part of the world, frankly, has a lot of work that needs to be done when it comes to healthcare. I mean, Singapore itself is one of the best healthcare systems on the planet. I think it's consistently voted the most efficient dollar for dollar healthcare system there is. But our neighbors in our backyard can't say the same thing. Like within Southeast Asia, we've got 680 million people that pretty much all have healthcare systems that are deficient in one way or another due to decades of chronic underinvestment in human capital and infrastructure. And so as we were starting to do, consulting work in the region, noticed a lot of people that were really getting sick and dying from things that were entirely preventable. And at the same time, our clients were looking for on the ground partners that could help them come up with ways to improve healthcare, either through improved financing models, education, delivery, or new technologies, because they couldn't really do it themselves. Because a pharma company is really good at developing pills and shots, but they can't really do any sort of value add service on their own. They can't really figure out new financing models and implement them, and they can't really deliver new models of care so readily. So they were looking for partners. And so there were a lot of entrepreneurs that were trying to solve these big problems, but they were really, really early in their journey, and getting any sort of funding was really difficult at the time because a lot of the local investors, they had all sorts of different options, and they perceived anything healthcare as being really slow, technical, risky. So I thought, well, why don't I start to angel invest? Because my taxation situation changed significantly between going to Canada and Singapore. And I think I was doing reasonably well at my job. So they, kept giving me salary increases. So I thought, well, why don't I put some of that to work to help entrepreneurs really be able to realize their dreams of fixing healthcare in various ways through technology.
Would you say that you started out investing yourself, your own finances, and that helped you explain to other people how to do it?
Yeah, that's exactly it. Although I never in my mind had the expectation or conception that I would actually do this for a living and actually become a venture capitalist. I had at the time thought, I'll earn my nice executive salary and I'll invest in a few angel investments every year and I'll just keep doing that. And then, over the course of time, and I started doing this in 2014, it was around the end of 2017 or so that I came to the realization that I enjoy this angel investing a heck of a lot more than I enjoy doing my, day job. And it was also having a heck of a lot more impact on people's lives. And then seeing some of these companies raise subsequent investment rounds, I thought, well, actually, it might also be a pretty good way to make some money as well beyond earning a salary. On the other hand, the amount of work of managing by that time, a substantial amount of angel investments started to compete with my attention of doing my day-to-day job, which was already quite demanding because next to investment banking, management consulting is probably one of the most physically and mentally demanding corporate jobs there is. This is not to compare with ER doctors or firefighters or anyone else, but in the journey of the corporate ladder, these are the two most demanding professions from my understanding.
Do you think that that authenticity that you had done this yourself and that you had achieved some success in it? I'm sure when you were looking for other investors, you were able to translate that well.
It certainly helped. So that was certainly working in my favor when I came to the realization that I wanted to do this for a living and I needed to raise external capital in order to do this. On the other hand, I've never worked in venture. I've never raised money before.
Right. So you had some things to learn.
Yeah, a lot of things to learn. So there were a lot of investors who were hesitant in backing a first time manager. even with first time managers who have worked in venture for quite a while, it's still a difficult journey. And I think for me and my partner, it was pretty challenging, but I was pleasantly surprised that we actually managed to pull it off and that we're still here 3.5 years later.
So you kind of touched on this a little bit, but healthcare in other countries, particularly those in North America, what are some of the key differences between other markets and those in Asia?
Well, every healthcare system is different. There's always a set of circumstances that's called pathway dependency as to why a healthcare system is the way that it is. And generally, if I were to kind of boil it down, I think it's really the financing models that really set different healthcare systems across different markets apart. So you've got all the way from fully paid by a central payer to fully paid by multiple payers to mixed payment model where you have a public layer and a private layer to fully private healthcare systems that are maybe private health insurance or covered by your employers. And then you've got ones that are fully like cash out of pocket because there is no financing mechanism otherwise. And then you probably also have the quality and accessibility of healthcare systems due to historic, investments, which were set really by the priority and wealth of a nation. And those are the key differences. And then there are some countries that have their own medical practices that go back sometimes thousands of years that are markedly different from a philosophical basis versus Western medicine. And so you've got a great diversity of healthcare systems out there. And the more established it is, the more difficult it is to try to change something.
True. People get set in their ways. I love the mantra, health is the world's greatest wealth. And I would like to hear more about that philosophy and why it's so relevant. And also talk a little bit about your efforts at Verge and that strong foundation in this philosophy.
Oh, thank you. I can pose a really kind of extreme example. Would you rather have the physique and mental clarity of an Olympic athlete with $0 in your pocket, or would you rather have $1 billion and be paralyzed and wheelchair bound?
Right? Man, yep, no brainer.
And so the other thing is, if you're a developing nation on the trajectory you're trying to become better, I firmly believe that health and education are the key foundational elements by which a nation can progress and mature. I mean, if you're not healthy, if your population is suffering from massive amounts of blood-borne parasites or whatever, how are you going to be productive? How are you going to put in the work to study, to build a foundation, to build a country if it's really difficult for you to just get out of bed? Or if you're blind, or if you're immobile, or if you're undernourished, how can you build a nation if you can't build yourself?
I'm curious too. I mean, I can't help but ask how COVID unexpectedly impacted investments in some of these areas when people were just fighting so hard to sort of figure out this disease, this pandemic.
Yeah, I'd say it's a mixed bag. I hate to say it, but I think it's been a net benefit.
There's silver linings. We can look at the silver linings of this thing, right?
Well, suddenly the entire planet realized what it's like to not have access to healthcare because if you're quarantining or all your appointments were canceled because the COVID patients had filled up all the hospital beds, now you know what it's like to be a patient who doesn't have access to a hospital. And then this whole concept of telemedicine, which payer said is too difficult to finance or doctor said it's just not good enough. It's not like dealing with a patient in person, had to, out of sheer necessity, experiment with these models, and lo and behold, they're actually not that bad. I mean, there are a lot of things that you can't do over a video consultation, over a text message, but there's a lot of things, it turns out, that you can. And while the use of telemedicine has certainly declined since the peak of COVID, it's still magnitudes above of what it was before. So a lot of these, like, you know, we can't ended up being we must, and it's not so bad. Pandora's box has been opened. There's no going back. Telemedicine is here to stay.
Yeah, there's no question about that. So, one of the primary drivers for a new health ecosystem is the raising cost of healthcare, right? We can't avoid this. We can't not look at it, except in Canada, it's totally different. And I would love to hear more about that if it's relevant in terms of Singapore's, how they handle the cost of healthcare versus what we do here. And when you think about the future of healthcare with regards to quality of treatment and the cost of it, what technologies are most attractive as investments today? And where should we be thinking about investing in terms of this space? And how will that change in the future?
Sure. That's a
Mouthful.
complicated question. So
Yeah.
I think I'll answer it. I think I'll answer it chronologically from the order it was asked. So yes, rising costs are a big deal, especially in Western markets and especially in the US, where $1 out of every five of GDP is spent on healthcare, which is pretty crazy when you think about it. That's over $3.5 trillion for 4% of the world's population. So it's over 55% of total healthcare dollars spent on planet Earth for 4% of the population. And it's not really 4% because there's a whole bunch of people who are uninsured. So it's a really big issue. And we have to look at what is driving all the costs. It's not going to your GP. Hospitalizations, some of the premium medications, but it's mostly hospitalizations that are the cause of all these things. And what drives people to the hospital these days is not so much getting in a car accident or getting really sick with something. Well, now COVID, yes. But pre-COVID, it wasn't. Most of the things that drive you to the hospital are consequences of your lifestyle and behavior and diet. Chronic diseases, non-communicable diseases. These are the things that send people to hospital. And these are things that are also largely preventable with the right course of action. Some people really want to rely on treating the symptoms with medications. They're like, I like eating unhealthily, not sleeping enough, drinking and smoking, and I'm not going to compromise. I'm just going to, hey doc, fix me. You've got a pill for it. Let's do it. And then sure, that may put a Band-Aid on the wound, but it's not going to fix the underlying cause. And that still drives up costs in the long run. Whereas if you are able to prevent it, then you can save tremendous amounts of money. And think about if you avoid spending, say, $1 million on a preventable series of complications to do with a liver transplant or bone marrow transplant or whatever, what could you have done with that money elsewhere? How many other patients could you have helped? What impact would that have if you put it into public health and prevention? Because right now we are not spending money on healthcare. We're spending money on sick care. We're spending money on you when you're already sick.
Say that again. We're not spending money on healthcare. We're spending money on sick care. Wow. And then in terms of investing, how do you invest in people's ability to take better care of themselves? Like what's the model there, Joseph?
So I'm going to have to, do the standard disclaimers of this is not investment advice, merely
Right.
my
Right.
point of view on what needs to be done and where resources need to go.
Exactly. Yeah.
Like historically, if you want to make a lot of money in healthcare, you just invest in a blockbuster drug. Now, which drug that's going to be, to me, it's a bit of a lottery, but you can make multiples of your initial investment if you happen to hit the right target. And I don't think that's necessarily going to be the case going forward, especially with budgets, being constrained as they are. Now, it's always easy to kind of picture the world where it's going to be. The difficult part is figuring out when and what are the steps in between the way. But the areas of investment which I think are necessary, and these may not necessarily give you the kind of returns you'd historically see in pharma, or maybe they would. I mean, if you look at Teladoc stock, and if you got in early on that, very comparable returns, right? So if you really start investing in the technologies that separate data collection from decision making, that would be really, really powerful. Because why should you have to go to a hospital to get spirometry information or to get your various blood testing results when you could potentially do this from the comfort of your own home? I mean, we're already doing this with our home blood pressure. We have home thermometers, we have home scales. Some people have continuous glucose monitors at home.
Now
Really
there's these
valuable.
heart monitors. My parents both have them. They've had pacemakers put in and they've been monitored from all over the place, riding their bikes and yeah.
Yeah, exactly. And this is just going to continue. I mean, you're going to have more and more affordable clinical grade Internet of Things devices that are going to be able to get the kind of telemetry that'll allow doctors to make a decision that is not perhaps better than what they would have had from a single visit and able to intervene earlier. Because if you see something that deviates, like if you're driving on a highway and you're looking at the road every 10th of a second, you'll notice the moment that you deviate. Whereas if you look at the road every 5 minutes, the next 5 minute interval, you might be in a ditch.
Right. It's really interesting though. I never thought about like, how would I invest in this kind of a thing? That's sort of fascinating. I don't know if you could walk us through an exact example, like in cancer prevention, for instance. How do I invest in cancer prevention? Obviously, if people are getting less cancer, that's going to save all kinds of things on chemotherapy and radiation and all this stuff that, insurance is having to pay for.
Yeah. So, what do we know about cancer? Well, we know, for example, if you were to catch a cancer in phase one or stage one, you could basically cut it or burn it, radiation or surgery.
I'm a stage 0 cancer survivor, a teeny millimeter. I had breast cancer, DCIS. But when they did go in to get it, they found 2 millimeters of invasive cancer. And I just was so grateful that we made the decisions we did. So I'm an example of that. I never think about that. You know what I mean?
That's fantastic. And I mean, it's awful that you got cancer, but it's fantastic that you caught it at such a stage that the cure rate is virtually 100%. And how do we do that for every possible kind of cancer that exists?
And genetics are so interesting. And I would love to hear more about that because, like with the BRCA gene and all that, my mom and I had an indeterminable gene. My mom also got diagnosed with breast cancer after me, had I known it before. And there's a genetic gene they couldn't even determine, an indeterminate gene. But you had started to talk about that as preventative. What more can we do to find out about our genetics to keep health as our greatest wealth?
No, it's a great question. And it's a tough one because there was a study recently that showed that pretty much every gene in your body has been linked to cancer in some study or another. And similarly, if you find what chemicals or what foods cause cancer, I'm sure you can find a study that links pretty much everything out there to causing cancer. So there has to be this kind of signal to noise discrimination that will emerge with enough knowledge of the entire context of the whole sum of your lifestyle, environment, upbringing, genome, epigenome, microbiome, metabolome, microvirome, and all that sort of stuff. And it's an immense amount of information to take in. And I don't think a single technology or a single group or a single company will be able to make sense of it all. But until we really take into consideration all of that and how it makes a difference in each of our lives, it's going to be really, really difficult to get 100%. However, I think that we will be able to capture a lot of this through studying the cancers that occur the most and why they occur the most. And this is where a lot of the genetic testing is really going into, and where you've got companies like Grail that are developing early cancer tests for tens of different type of cancers. But to really get 100%, to really get all the edge cases, we really need to understand this combinatorial explosion of what's there, or be able to build simulations, pretty reasonable simulations like digital twins, I think the term is called, to really see what deviations in our baseline may result in what sort of phenotypic outcomes.
And in terms of investing, could you explain in a layman's term, like how would that actually happen? And are we only talking about big business or is there some private investing that can be done in this way?
There certainly is. So the nice thing about the United States, and I'm assuming most of the audience here is from the US, is you've got the Jobs Act passed. And that gives a mechanism by which retail investors can participate in private investment opportunities. Because historically, retail investors in the United States were restricted to only public equities. And that's unfair because a lot of the exciting stuff is not occurring in public companies. I mean, sure, you can invest in a stock like Tesla and you could have bought it at $60 and watched it go up to 1,000, which will beat most venture capital returns out there hands down. But that's kind of more of an exception than the norm. And similarly, in private investing, there's a ton of companies that die. And I think because of the high risk nature, there was a thought that maybe it's not a good idea for retail investors to be involved in that. But that sentiment has certainly changed over time. And there are now more and more mechanisms by which you can do this. I think AngelList is a platform which is particularly popular. There are opportunities for individuals to also get involved if they're in a certain class of investor, which is based on an income or net worth threshold, which puts you in a category called accredited investors. And then it's really a matter of access. It's a matter of how do you find these particular deals which will give you the opportunity to participate and own a bit of these companies. And I think if your audience is really interested in the space, probably start from an area of strength. So if you're a nephrologist, then maybe look for companies that are doing something in the area of nephrology and trying to alleviate a known pain point. And honestly, the time I've lost the most money in my life is investing in things I didn't fully understand. So if there's an area that you're knowledgeable about and passionate about and have an opportunity to meet entrepreneurs, first, maybe to mentor or to be kind of a clinical advisor, that's an easy way to really understand the business and understand what you're getting into before actually cutting a check and putting some money to work.
I really like that. That's really taking whatever your life's purpose is and turning it into your finances. I mean, that's just got to be good for the universe right there and good for individuals. So, one point of view with the TechLink Health Initiative is that the interoperability of technologies, data, and people will shape the landscape of the future. So, what role does venture capital play in these orchestrated efforts? What does interoperability mean to a VC?
Yeah, I think that word will mean different things to different investors. There are different philosophical approaches that investors have. I mean, some investors want a pure financial return. And if that's the case and it's on a short term time horizon, interoperability is a bad thing because why would you want your $1 million patient walking across the street to go to seek the services of an asset that you don't hold a stake in? And I think that's historically been a really big problem. Then there are others who take a broader lens on what's good for the ecosystem, what's good for the long term, what's good for driving societal value. And there's a really good piece of advice I received a long time ago saying, I wouldn't say a piece of advice, sorry, a good wise quote that said, being in venture capital is choosing the future in which we live. So by providing capital or withholding capital, you essentially choose the technologies that have an opportunity to get out there and choose the founders whose vision, mission, and values align with the future world that you want to build. And so the simplest way of venture capital playing a role in this is backing founders that want to work to build an ecosystem. And at the core of this, working with others, sharing data, keeping to a common standard is a given. If you want to be a little bit more hands-on, you can say, look, we're going to only invest in you if you say everything that you produce is, say, built on an open EHR platform or is using like HL7 Fire. And so our approach at Verge Health Tech is we're not so extreme and to say that we must all use the same common data language, but we would highly encourage the founders that they do.
Excellent. So, to wrap up, any final recommendations for those interested in staying connected to the next wave of innovations within healthcare?
I think you've got to be willing to experiment. Find areas that you're really, really interested in learning more and get involved. If it's not being a mentor or trying to be something more hands-on, you can be a beta tester. If you're a clinician, help them out with clinical trials, help them out with mapping the patient and physician journey and understanding where they fit in all of this and whether their initial hypotheses are correct or not. Because right now, the biggest barrier to adoption of new technologies is physician bandwidth and physician willingness to change the way that they practice medicine or the administrative layers in how they want to run their health system. That's the biggest barrier. The challenge is not so much the technology, it's really all of the people organization stuff around it.
This is just a side note. I'm just curious with all the telehealth that we've all experienced globally in the last year and a half, has that freed up any time to really take a look at this, do you think, from the inside out, from the doctor's point of view in their offices to kind of address this a little bit more?
I think selectively, I think depending on which domain you're practicing in, you may find yourself having a heck of a lot less time, like say if you're in the ER, for example. But certainly COVID has given all of us an opportunity to kind of take a bit of a pause and figure out what's important and how we want to do things a bit differently.
Well, how do we stay in touch with you to follow what you're doing, Joseph?
So I have a blog that I occasionally write to, jmokanu.medium.com. Also have a website with appropriate contact links, whether you're a partner, an investor, or a startup looking to work with us. That's at www.verge.fund. I'm trying to get a bit better at this Twitter thing, jmokanu.
That darn Twitter thing. Yes.
Yep. I think I've made like 6 tweets in the past decade.
How about the Insta? Are you on the Insta, Joseph?
No, sadly, I'm not on the Insta.
Okay,
I am on LinkedIn, but
okay, good. Well, we can find you there. Well, this has been super fascinating. Thank you so much for joining us.
Awesome. Thanks so much, Justine, for the opportunity, and have a wonderful day.
Thank you. You too.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.